Excellent. So as we mentioned, right, brand new year, brand new program. We have been going strong since July 8th, right? So July 2024 was the first day of our new class. You can see this is our very first cohort in the pictures here. They have been busy, busy. So we have started them right away. They just finished an intensive 5-week class session. They were taking cadaver anatomy, foundations of evidence-based practice, and patient evaluation, and then also um, essentially their their care and prevention course with Mary. And so they had a very, very busy summer. We actually went through suturing and casting, a couple of the skills that we highlighted. They hit the ground running. So clearly, as we've kind of mentioned in the past, this current program is an extension of our 10-year accreditation that we received in 2022. And a key part of the program itself and of our student success is clinical experiences and clinical education, of which all of you are an integral part, right? And so all of you are uh, really one of the most important components to our program, particularly with the clinical education that you provide. And I think all of us, as healthcare providers, would understand that probably some of the best, the most of the learning that actually happens to us, right, as we're learning how to be clinicians, actually happens in practice, right, and in hands-on environments, and not necessarily as much in a classroom. Although both are useful, we tend to get more mileage out of our respective clinical experiences. So, obviously, a big thank you to all of you for being preceptors. Ultimately, the working definition of a preceptor, right, is someone that supervises and engages students in clinical education. Um, in whatever discipline that you happen to be licensed and or certified or both as a healthcare professional, it is required that you maintain that license in order to be a preceptor, right? So if you are an athletic trainer, you are required to be licensed or credentialed in the state in which you practice, as well as in good standing with the BOC. So, with any of our physician preceptors or potentially PA or MP preceptors, all of you must be licensed in the state in which you practice, and that license obviously must be current. Um, we'll talk in just a second about the 3 different types of clinical experiences and how those contribute to clinical education. But ultimately, the vast majority of the experiences that our students are going to be participating in within the program are what we call athletic training clinical experiences, and it is those experiences that are directly supervised by an athletic trainer and or physician, right? We will have within the program, and Nissa, you and Heather will be an integral part of this. Supplemental clinical experiences. So those are clinical experiences that are essentially supervised by, other providers other than athletic trainers, such as physician assistants, nurse practitioners, so on and so forth, right? And so our general medical experiences meet the very definition, as it were, of a supplemental clinical experience. All of our preceptors, and I'll send a reminder to you as well after we are done, a welcome email with a reminder, but we would ask that all of our preceptors uh, maintain and submit for athletic trainers, their current BSc certification, their current license, right? If you have an MPI number, please submit your MPI number as well, and then a CV and or resume, and I can upload that for you into eValue, or you'll also have the ability to do that on your own. Um, if you so choose, right? So the other requirement, and we're going to spend just a little bit of time on this shortly, is a contemporary expertise table, and I will explain that to you. One of the things that the Commission on Accreditation for Athletic Training Education, also known as CATIE, abbreviated CATIE, requires is for all preceptors to maintain current contemporary expertise, right? And we'll talk more about what that means. So this year, a fairly significant change. We have actually made a big shift, right, to a brand new automated platform that we're utilizing for organization and management of not only of all of our records, but also for all of our evaluation and assessment data. And that's taking place in a platform known as eValue. Any of you that are preceptors potentially for other programs, this is a platform that is utilized obviously through with medical schools, PA schools, in nursing, and also now in athletic training programs, right? So all of our student evaluations, their time logs and their case logs are going to be submitted through eValue, right? So all of you as preceptors, Reggie, I believe that you're the only exception, and I will do that today. All of our current preceptors have already been added to eValue. And after we get done today, you're going to be receiving a welcome email. And then following that welcome email, you're going to receive an email from eValue prompting you to reset your username and password so that you can log into the system for the first time. So I may have to toggle back and forth between screens for this next couple slides. But what about when you log into eValue, right? What are you going to see? And this might be a little small. So what I'm going to do is I'm going to actually share another tab with you guys for just a moment, if you'll humor me for a second. So this is the login screen for eValue. You can see this is my account, right? I've got my email address and my password. I'm going to go ahead and log in. So once I log in, what's going to pop right up for me in eValue, if it would let me log in, let's try that again. There we go. All right. So, and I actually, other tasks, homepage. There we go. Back to my homepage. Okay. So, right, this is what is known as my dashboard. Okay. And what I want to bring your attention to, and I'll show you an example of this in a second. You will see, right? Let's say that maybe you have some, you're prompted to maybe sign off on some hours and or maybe do an evaluation. That will pop up for you directly on your dashboard here. Okay. So I'm going to log in as another user really quickly. And I'm just going to show you an example of what a dashboard with tasks to complete might look like. All right. So we're going to log in as Troy for just a second. And let's take a look at Troy's dashboard really quickly. Okay, check this out. So if we look directly at Troy's dashboard, the first thing that we're going to notice is that Troy's got a couple of time entries to sign off on, and then he's got a couple of case logs, or he's got a handful of case logs to sign off on too. I will actually walk you through how to do that later on in the training. So I'll actually, it's extremely simple. It's literally just as easy as clicking a button and hitting submit. Right it's not necessarily a laborious task. Right. The other thing that I want to point out to you, if we look on the right hand side, all of you will have access to this. So you'll be able to see on the right hand side, you have a link to not only our student policy and procedure manual, but also our preceptor policy and procedure manual, right? And that's included for you, for all of you, are right here on your dashboard on the right-hand side. Let's also say, for example, that maybe you are, excuse me, you are maybe filling out your contemporary expertise form for the first time. You're like, I don't know where to find that. Don't worry about that. It's right here on the dashboard or right underneath, right? So you can literally click on that. It'll pull up that contemporary expertise form, right? And it's going to prompt me to open that. And so you can simply just open that and you can start filling out that form, right? And that's not going to open for me. That's fine. All right. So within the other thing within eValue that we wanted to actually also make sure that all of you as preceptors, right? And we've made an effort to do this in the past, but we really want to kind of try to keep this as current as possible and have it represent real time what the students have actually done and what they're learning, right? So you can see, excuse me, that all of the competencies that the students have actually already been through and been signed off on, everything that they can do lives over here on the right-hand side. So if you're curious about what are they learning, like what exactly have they learned in class, and what as a preceptor could I expect them to be able to actually do with a patient, all of that's actually contained for you right here on the right-hand side, right? So, and we will actually continue to add that here as well, right, as we continue to work through the course sequence with the students. So that there will be more competencies that will actually pop up. And then lastly, down here on the bottom right, you're going to see these eValue educator resources, right? So these are little reminders here and there. Let's say, for example, that maybe it's been a little bit, and you maybe do not quite remember how to sign off on a case log, or to maybe even complete an evaluation, or to sign off on uh, you know, hours or what have you. There are links to videos right down here that you can simply click that will just give you a quick refresher. And these videos are no more than a couple minutes long. Very, very just simple instructional kind of prompts for you, right, to be able to review that if you feel that you need to. All right. So that's just kind of a brief intro to eValue. As some of you probably actually already have experience with that, particularly working with other programs. So, okay, let's revisit just for a minute our contemporary expertise form, right? So, and a lot of this clearly, right, is relevant to athletic training practice, but also obviously can be adapted, right, to whatever profession that you're practicing in, whether it's nursing, whether it's medicine, so on and so forth. So obviously with an athletic training, right, we have various different routine areas of practice: prevention, emergent care, primary care, orthopedics, rehab, behavioral health, pediatrics, so on and so forth, right? So ultimately, all of us as clinicians have areas that we feel that we are very strong in, right? Maybe areas that we're passionate about, areas that we have a ton of experience in, so on and so forth. Um, and through that experience, we develop a certain level of expertise in that area. Okay. So the overarching point of contemporary expertise is for you to attempt to marry, right, your areas of clinical practice and strength and expertise with your goals as a clinician, your goals for professional development, right? So when you are filling out your contemporary expertise form, right, you may you're going to be prompted to select an area of specialization, right? Maybe that's, general medicine. Maybe it's advanced nursing practice, whatever that might be for you. Maybe it's a specific area of athletic training like pediatrics or orthopedics, right? And so you can list those as areas of specialty. And then on the contemporary expertise document, you are expected to essentially show how you are supporting that expertise through various, maybe it's presentations, maybe it's meetings that you've been to, maybe it's the fact that this is what I practice and I do it every day. Maybe you published a paper or you are a part of a research project within a certain area that's relevant to your practice, right? All of those can be listed on a contemporary expertise form. Okay, so as we've already mentioned, you can obviously achieve contemporary expertise through obviously advanced education, your own clinical practice, research, scholarship, presentations, attending meetings, so on and so forth. So clearly, we would want your contemporary expertise to be current within a 3 to 5 year window, right? And really, we are we are really wanting to see quality over quantity, right? So generally, having one either substantial activity or maybe multiple smaller activities within a specialty area, right? So and I'll skip these cases because I just want to kind of get down to it and show you an example. So this is mine, okay? And to be fair, I need to update mine because mine's a couple years behind, right? But here's what it looks like. Okay, so got my name here and my role in the program. Um, these are my areas of contemporary expertise, at least as defined by me. Pardon me. Primary care, orthopedics, and rehabilitation. Right. So ultimately, what I've given here is different conferences that I've attended. The date I attended a meeting, the Katie conference. Right. And ultimately, the one thing. Pardon me for coughing. The one thing that I would also encourage you to do, if you can give me a little blurb just underneath the meeting of how you feel like this supported your contemporary expertise, I would be highly appreciative of that. So let's just kind of go to the next slide here. But you can see, right, primary care. Okay, this is another area that I listed. So this is a research area. I wrote a paper on primary care, right? So I have that listed here, right? CEU activity. I presented to, an athletic training program over hip pathology, so on and so forth. So this is how I am demonstrating my contemporary expertise, right? By listing meetings, clinical practice areas, so on and so forth, throughout my years of practice. Okay, so if you need obviously further help with this, we have obviously a form letter that we can send you. But I want to encourage you. This is also an area that I can help you with, myself or Mary. We are happy to help. If you have questions about how to complete this or you need a little bit of help, please don't hesitate to contact us. We will help you with this if you need help with it. So as you'll see in the welcome email afterwards, obviously for all of our athletic trainer preceptors, sending an updated copy of your BOC and state license is going to be highly appreciated, along with your updated contemporary expertise form as well. right? And I think CPR was the one thing that was not mentioned, so I apologize. So obviously our program, right? Clearly, our program's been around for a long time. We've been around for nearly 50 years. Um, and because we are working within the framework of a liberal arts institution and education, right? We want to try to provide our students with as broad and diverse of an experience as possible. And we are hoping at the same time that the program and that the experience aligns with the university's core values of excellence, community, justice, service, and faith, right? And so we are very, very focused on and committed to providing our students with an education that aligns with those goals. So with the advent of a new program, we actually have some new learning outcomes that we have developed for the athletic training program, and I'm going to go ahead and go through those with you here briefly. So we have five learning outcomes that we've developed for the program. So the first one, obviously, being that students will attain necessary knowledge and skills to demonstrate professional preparedness, including a capacity for lifelong learning and professional growth. So really and truly, this comes down to the psychomotor, psychological, and professional skills and abilities that it takes to become an athletic trainer and to become a clinician. Right? All of us know that uh, gaining experience as a provider doesn't happen overnight, and it's something that takes time and practice and constant learning, uh, both obviously academically and clinically, right? So uh, and those are actually repeated here again, but ultimately, um, we are wanting them to not only obviously develop skill, but be able to work within a team environment with different healthcare providers as well. And we believe that our clinical experiences are set up to facilitate that aim. Apologize for the formatting on this slide. So the second learning outcome, right? Students will develop basic knowledge, skills, and experience in reading, understanding, and integrating current health-related research. So ultimately, this comes down to evidence-based practice, right? And one of the strengths that I think we have as a program, we have a lot of diversity amongst our preceptors, varying levels of experience and varying backgrounds. And I think that that's absolutely incredible because it allows our students to see and have another perspective on how you as a clinician implement evidence-based practice into your own practice. How do you utilize the evidence, right? And all of us do that differently. All of us, are looking at the evidence in a different way, and I think that having those diverse experiences and perspectives is something that only benefits our students. Okay, outcomes 3 and 4. So, number 3, students will experience opportunities as an individual or part of a group that allow for engagement in community justice and service, right? So one of the things that we want our students to be able to accomplish is to be able to work with patients of varying backgrounds. A strength that I think we have, and this is particularly true in a lot of our clinic-based experiences. So general medicine, orthopedics, our students are really seeing and working with uh, patients from really diverse backgrounds. Um, at one of our clinics in Mankato, where our students do their general medical experience, approximately one half of the patient population at that clinic requires either the use of an interpreter to receive care, or they are on some type of government assistance to be able to receive healthcare. So um, Number 4, right? Students will communicate effectively. We expect them to be able to communicate, particularly as grad students. We expect them to be able to communicate well, obviously orally and verbally, right? But I think the thing that's the most important, and I think all of us can agree on this. The other area where they have to also learn how to communicate appropriately is non-verbally, right? Because even more than what we say, right, to a patient during an encounter, patients remember everything that we do, right? Our non-cues and communication are so incredibly important. And so we want our students to become excellent communicators orally, in writing, right? And then also, obviously, non-verbally as well. Another just quick note, okay, on written communication. If you have a student that is in an experience and is documenting with you, right, and or maybe they're documenting a portion of an encounter, right, you know, make them work for it. If you see something within their documentation that you think could be improved, don't be afraid to tactfully let them know, because all of us know, right, as providers, that documentation is obviously incredibly important. If you don't document the encounter, it's as if it never happened, and the patient encounter is only as good as the documentation that reflects it, right? So, um, if there is anything that you see within our students' documentation that you feel that you can help them improve on, don't hesitate to do that, right? So, and then the fifth one, right? Students are going to engage and reflect on professional ethics and behaviors. Um, so, particularly as it pertains to their own personal values and morals, and the application of those to athletic training. One thing that we have done within the program this year that we've never done in the past, we've actually included the recitation of what is called the Athletic Training Manifesto, which is essentially, excuse me, a preamble to the Athletic Training Code of Ethics, right? And we actually have the students recite that. It's almost kind of like a white coat ceremony for athletic training without the white coat, right? So we actually have them almost kind of recite that as an oath, right? And as a reminder that they are required to practice in an ethical manner, and treat all their patients in that way. Okay, let's go ahead and keep on moving. We're going to talk about clinical education. Okay, and once again, all of you are relatively experienced preceptors, so this is not going to be anything new to you. So, clinical education, right? This is essentially a broad umbrella term that really includes and encompasses three types of learning opportunities um, to help prepare students for independent practice, right? Those are athletic training clinical experiences, simulations, right, and then obviously supplemental clinical experiences. Um, the athletic training clinical experiences, as we've already talked about, are those experiences that are supervised directly by an athletic trainer or physician, right? And those are a lot of our collegiate and high school experiences. Some of our clinic experiences were there, under the supervision of potentially Dr. Fetzer, or maybe another physician provider at TRIA, or an athletic trainer provider at TRIA, right? Obviously, supplemental clinical experiences being our general medical experiences. Um, and then our simulations, right? This is actually kind of a big area. So simulation is a very um, has become a lot more common as far as a method for assessing clinical preparedness within academic programs, particularly in regards to practical skill. Um, so, as an example, our students, at least in my class, at the end of July, were required to walk into a room with a standardized patient and actually administer a head-to-toe pre-participation physical exam. They actually did really, really well. So they were required to go through, take a history, review the form, do everything from range of motion examination to manual muscle testing, to a head-to-toe neurological exam, right? That includes cranial nerves, dermatomes, myotomes, deep tendon reflexes, and then obviously pathologic reflexes. And they know all of it. So in the event that they're going to be walking into an experience with you, they should be able to do the basics of an exam, and they should be able to talk to a patient, right? So we wanted to really get them as active as possible, as soon as possible, with those patient interactions. And simulation's a big way that we've done that. And that will continue to be, based on conversations that Mary and I have had, a main way that we assess clinical skill in our students moving forward throughout the program. Um, Additionally, right, one thing that I would welcome all of you to do, I know that all of us are busy, but particularly in a lot of our settings, collegiate settings and high school settings, you can have days where the athletic training room is just really not that busy. There's not a lot going on. And so maybe you're just kind of catching up on some admin work, so on and so forth, right? But those could be opportunities for you to maybe set up a simulation with a student, maybe with a standardized patient, or maybe somebody that's in the room that would be willing to maybe just kind of be, that standardized patient to take the student through a scenario. Within our second year students that we'll have next year, we have um, an assessment tool known as a proficiency assessment, right? We won't cover that this year because we don't have any second year students at this point, but that will be something that we will bring back as far as discussion next year. And a lot of those are really based on simulation, particularly if there's not an actual patient there to be able to utilize for that type of an encounter or assessment. Okay, as we've talked about, the definitions, right, of the athletic training clinical experiences, right, I am not going to go through these again. We've been through these already. But so athletic training clinical experiences, simulations, and then supplemental experiences, right? The bottom line is that we want everything to obviously be as educational as possible, and we have varying ways that we accomplish that, as we've discussed. So here's the deal: our clinical education also at the same time has to follow a progression that is logical. So, for example, right? Um, and I'll use the example of our first year students this year walking into a clinical experience. um, should be able to do the vast majority, right, of a patient encounter. There may be certain region specific uh, examinations that they're maybe not signed off on yet to be able to complete, right? But all of that, generally follows a logical progression. So our first year student clearly is going to have a different set of skills and abilities than one of our second years. So for example, if a student chooses to maybe repeat or go back and do an experience in a clinic for their second year as an immersive experience, right? They will ultimately have a different set of skills and should be able to complete really the vast majority of a patient encounter, whereas a first year student will be a lot more limited, right? Potentially in their skills and abilities. The biggest thing that we really want to emphasize with a lot of these experiences, the students have to obviously gain skills and abilities and be confident in clinical skill. But one of the biggest things is they have to learn how to reason clinically and make both assessment and management decisions, right, with patients. And that is one of the key pieces, obviously, within any clinical experience. We would also hope that many of the patients that the students are seeing are going to be reflective of very diverse patient populations, and also obviously care providers, pardon me, and also obviously in various settings relative to our mission statement, right? Okay, uh, really quickly addressing again just the topic of ethics. Our students should not ever discriminate against a patient based on sex, ethnicity, religious affiliation, sexual orientation, or gender, right? And then obviously we will evaluate obviously on a yearly basis program sites, and we actually aggregate that data based on end of experience evaluations from students, and all of those evaluations are aggregated at the end of the year and sent back to preceptors, right? So students obviously, if they are learning with you in the clinic, they need to be instructed on a clinical skill prior to performing that skill on a patient. So we will do the majority of that obviously within the program through our competencies that we have the student actually doing. But let's say, for example, that there is a form, or I'm sorry, excuse me, let's say that there is a skill that is specific to your setting, or maybe there is a specific skill that you utilize within your practice setting that maybe the student hasn't had a lot of exposure to. Um, you should be and we have a form that I can share with you as well, but you should be able to demonstrate that, to go to the student and demonstrate to them how you want them to complete the skill, and then essentially have them and there's a form that you can sign, and they can actually complete that skill there in the clinic after it's been demonstrated to them by you as the preceptor. An example of that, uh, we have not within the program, we have not taught yet, and I think we will in the future, but we have not included, at least on the therapeutic intervention side of the curriculum yet, modalities such as dry needling and BFR, so on and so forth, and even some forms of instrument-assisted soft tissue mobilization. Um, and so, in the event that those are things that you utilize in your practice, and you feel confident in the student performing those skills, we ask that you demonstrate those to the student and kind of walk them through them prior to allowing the student to actually do those on a patient at your site. Excuse me. So the other thing too, and I know that this goes without saying, but all of our clinical education experiences have to be educational in nature, right? So students should not ever replace professional staff or medical personnel in any of the experiences. They are learners first, right? Another thing that we have, which I think is really awesome this year with our small cohort that we have, We have a small number of students. We have four, right? So we will always have a small number of students a small number of student to preceptor ratio. This year it's 1 to 1, right? Which is really really incredible. So that student is getting a lot of one-on-one attention from the preceptor, and the preceptors have a pretty light load, as it were. And I think I've mentioned this to you before. Our program is set to cap out at 20 students per cohort. We are working aggressively to add more clinical sites to our program, and that's an ongoing process that includes general medical experiences, so on and so forth. So we will be continuing to expand those sites, and as the number of students increase, the number of preceptors that we have in different areas will also increase, hopefully. So, okay, let's talk about clinical education policies. Okay, so obviously, in response to our Katy site visit in March of 2022, we developed a new clinical education policy, Mary and myself, um, and ultimately we came up with kind of this nice alliteration that you can see at the bottom. Right, we want the students to work towards autonomous practice, but we want them to do that in a measured fashion. So obviously, in year one, they're going to be exposed and they're going to explore different areas of athletic training practice. And then in year two, they're going to expand and examine. So year one, okay, expose and explore. So students are going to learn the ins and outs of obviously athletic training and other clinic environments, okay, in the collegiate, secondary school, and physician clinic environments, right? So they, pardon me, so sorry. All of them are currently about to complete their first ever immersive clinical experience, right? As their pre-season experience. Um, and that will be very similar to the experiences that they complete in their second year. So we have kind of two different types of experiences. We have our general clinical experiences that are going to last anywhere from 4 to 7 weeks, and then we have our immersive experiences that can last as long as 4 weeks. And those immersive experiences will all take the vast majority of them will take place in year two. The student will have a limit of 39 hours a week for those immersive experiences. So very similar to a full-time job, right? So really quickly, right, what I want to touch on, you see this bolded point at the bottom. We have developed a new experience for our first year master students known as the choose your own experience. Okay, so let me just explain a little bit about what that is. So as we've already kind of alluded to, the students in year two are we send them out all over the country to do immersive clinical experiences at many different locations. Um, and the choose your own experience is an opportunity for the student to be able to choose, right, from any different environment that's relatively local, right, a setting and/or an experience that interests them, or where they might feel that they want more experience, right? And this is meant to be kind of a warm up for the immersive experience in the sense of selecting a site, getting that set up, so on and so forth, right? So in this first year, the students will be completing those choose your own experiences generally towards the latter half of the spring. Um, so for example, let's say that they are in clinic with Dr. Fetzer, for example, and they have their OR observation date, then they have their clinic date, and they're like, you know what? I really like the clinic setting. In fact, I liked it so much. I think I want to go back and do a choose your own experience uh, at TRIA or in another clinic, right? And so we can potentially set them up with a preceptor who would be willing to have a student at that time, and then set them up with an experience. It could be, Division One athletics, so on and so forth. Maybe the industrial setting. So MSP Airport with Delta Airlines is another one of our sites. So the students have the opportunity to kind of choose within the first year as well. Okay, year two. So obviously in year two, as we've already alluded to, the clinical experience has become immersive, right? And all classes are moved online. So the students are highly focused in the second year on immersive clinical experiences, potentially anywhere in the country, right? And they are taking class with us, obviously virtually. So obviously in the second year, those experiences are meant, right, to allow more contact with diverse patients, and build trust and relationships with the preceptors, right? And we hope too that aside from just learning clinical skill, that they are also able to learn a little bit about administration too. They will be taking a class in the second year called healthcare administration, right? And so hopefully they're able to get a little bit of experience with the administrative side of clinical practice as well, right? So we will bring the students back to campus in the second year to obviously kind of get them connected to the first years and have them, kind of connect a little bit, help continue to get ready for the BOC, right? And then allow some time for not only simulations, but skill practice and development as they continue their immersives. We haven't cemented this yet, but we're even potentially discussing having kind of a mock mass casualty event as well, which we're really excited about to see if we can't, kind of really kind of make that kind of add that to that time. So, okay, so DEI, a little bit more about this. Clearly, every year, one of the things that um, one of the things that we have our students essentially reaffirm every single year is a commitment to diversity, equity, and inclusion. Um, and our program is obviously committed to fostering diverse perspectives within our program that obviously arise due to varying cultural and personal circumstances. Um, we want to make sure that all of our students obviously have access to opportunities to not only experience obviously diversity, but know how to essentially react and respond to the negative effects of bias, harassment, and discrimination, right? So obviously this form now lives in eValue, and they actually sign this form every single year with their onboarding paperwork. But um, anytime that a student, maybe sees or experiences something that is maybe not in step with the principles of obviously ethical practice and or diversity, equity, inclusion, and belonging, right? We would highly encourage them to not only speak with a preceptor, but also speak with us if it's warranted. And that also goes both ways, right? If you as a preceptor notice that a student is engaging in an unethical way, or is essentially engaged in a behavior that is not supportive of obviously an inclusive environment or an ethical environment, we would encourage you to contact Mary or myself. Okay, expectations for clinicals. So the students obviously, before they report for their first clinical experience, they have to essentially complete a series of onboarding tasks and paperwork, right? And that includes the handbook statement of agreement. So all of them are required to read through and acknowledge that they have read and understand the student handbook, sign a HIPAA confidentiality agreement, technical standards, including obviously which essentially affirms their ability both mentally and from a psychomotor perspective to function as an athletic training student. They have to uh, essentially sign a statement on communicable disease, update immunization records as well as having updated TB testing, right? So they'll have the current CPR card, emergency cardiac care, bloodborne pathogen training as well, right? And then obviously passing a background check, right? So all of those things are required for the students prior to starting in the program every year. Okay, so kind of a little bit more of the really practical and relevant stuff. Sorry, I've had a cough and I feel like I'm having to take sips of water every 5 minutes. Apologize. So the students are going to obviously be required to continue to track patient encounters and hours with an e-value. So the students are going to be responsible for logging those hours and encounters weekly. That is their responsibility, right? And the tracking of those encounters and hours is directly tied to their grade in the clinical experience classes. So 551 through 557, which I teach. So if they are not doing that, that will be reflected in their grade, right? So I want to actually show you, I'm going to kind of flip screens again. And what I would like to do, I want to walk you through the simple task, right, of kind of submitting hours. So really quickly before we do that, when a student logs in, sorry for the feedback if you're getting that, when a student logs into eValue to record hours for a clinical experience, okay, they will obviously select clinical hours. They're going to select the preceptor, right? and then obviously the rotation or experience that they're assigned to, the site, so on and so forth. And then they're going to obviously just kind of clock in with their start time and their end time, right? And that will actually, that's how they will log their hours, okay? But from a preceptor perspective, all right, what are you going to see as a preceptor? So for example, I'm going to go to my time tracking tab, and I should be sharing this. You guys should be able to see that. It's going to make me log back in. Love technology. All right. So what I'm going to do here, okay, I'm going to click sign off on student time entries. So on my dashboard, right, and we saw earlier on Troy's dashboard that he had some time entries to sign off on. What I'm going to do, I'm going to click on this link, and if I scroll on my calendar, actually, interesting, it's not here anymore. There is a there would be an entry right on the calendar. So let me go back to the dashboard here really quickly, guys. Sorry, just 1 second. So signing off on hours is actually extremely easy. Let me go down to the videos here, and I will actually show you. I'm gonna pull up this video, and we'll just take a look at this really quickly. Sorry, you guys.
Welcome to eValue's video tutorial on how to sign off on trainees' time entries. The pathway is time tracking management, manage time, sign off on student timed entries. This tool was designed for trainees who log duty hours with you as their supervisor for the month. These will display in the select box. Select the trainee student's name to review their entries. There are specific icons for review entries. The red icon indicates an entry that has not been approved. Click this icon to approve the entry. You may also use the icon next to the trainee student's name to approve all entries shown in the calendar month. The green check mark indicates that the entry has been approved. You will also click this to remove an existing approval. The last entry with the green plus will allow you to add a note to the log entry. Depending on your program's configuration, the totals column may display. Thank you. Welcome to.
All right, so pretty honestly simple and easy. It literally is as simple as literally just going in and clicking the red circle next to the time entry. The other tool, the other thing that you also have access to there is also the you have the ability to actually approve all entries for kind of bulk approval, where you simply just click approve all, and it will actually approve that entry. So let me go back. I'm gonna log in as Troy really quickly, and I'm gonna show you that again. All right. So I'm gonna go back to Troy because Troy had some entries to sign off on. Okay, so here's some time entries. So I'm going to go into Troy's account here, and they are not showing up. Okay, there we go. Perfect. So these are the hours, obviously, for Katie. You can see that Katie has had, obviously, she's been signed off on hours here, and all of these check marks indicate that all of these hours have been signed off on. So here's the 26th. So that's Monday. I'm going to go in, and I'm just going to click that. And you could see that now if I scroll back to that, there's a red exclamation point next to it, right? And I'm just going to click that. Now it's been signed off on, right? And I could, once again, if I have a lot of hours that I haven't signed off on, but I know they were here, they came in, I know that they were here for the time that they said they were here, I can actually go up here and verify all for that student, and I can verify all those hours at once without having to go through and click every single little check mark or little exclamation point, right? So that's hours. So let's talk really quickly about case logs. Okay. So let's say that a student, okay, has a let's say that a student, has a case log that they've done, right? Within an experience, and we want to sign off on that. Okay, check this out. So this is our student Katie again. Okay, she's logged a few different case logs here, right? So she had an ankle tape job here that she logged, right? So on and so forth. And for these, right, as you can see, All I'm going to do, because I know she did it, right? I'm just going to go in and just click confirm. That's it. That's all I have to do, right? And once again, as we talked about, if she's got, quite a few here, I can simply just click confirm all and I can be done. That's it. Okay, really, really simple and easy. Okay, so I'm going to pause for 2 seconds. I know that we've gone through um, a lot of things in eValue. I want to pause for a second, and I want to see if you have any questions that I can help with. We're actually getting close to being finished. We're halfway done. Um, Anything that I can help with before we move forward? We're good. Okay, fantastic. Thank you so much, guys. Once again, I know that this is an enthralling way to spend your afternoon. We're gonna keep on moving here, and we'll get through it. Okay, so um, patient encounters. We've actually already gone through that. These videos killing me. Okay, let's talk about code of conduct, obviously for clinical education. So obviously, we expect our students to be prepared, be on time, be dressed well. And one thing that I want to emphasize to all of you as preceptors, in regards to student dress, right? We are going to we're going to let you dictate what you want from them as far as dress code, right? So in the event that you want them maybe in an athletic training polo and maybe some slacks or khakis, or maybe you would say, you know what, it's actually more practical in this situation for you to be wearing scrubs or what have you, right? We will let you dictate the dress code as you see fit, right, for your setting. Obviously, we expect them to be engaged and be professional at all times, right? And we've already talked about this. It is their responsibility to record hours and track their patient encounters. Um, and to follow the expectations that you set for them as a preceptor, right? Um, okay, so here's the deal, right? Preceptor responsibilities, um, supervision, right? This is kind of a term that is a little maybe a little bit nebulous. I mean, on one end it means supervision, but then at the same time, it also is something that allows the preceptor to establish a level of comfort and trust between the preceptor and student during the clinical experience and during the patient encounter, right? So you're obviously providing instruction and assessment of the current knowledge and skills that they have, right, through evaluations, but right, you are also assessing and providing feedback on their clinical abilities. Um, so really and truly, that comes down to obviously, helping them develop skills and communicate as well as communication skills, and then obviously helping them foster good clinical decision making, right, during within patient care. Okay, so um, obviously we've already talked about obviously clinical skills and helping them with decision making, but obviously through being present at this training, you are fulfilling the requirement of being in compliance and demonstrating understanding with our policies and procedures as a program. So thank you all for taking time out of your day. Okay, this is pretty important. So when they come to your site, okay, being oriented to your site, what exactly needs to happen when a student comes to a clinical site uh, and is essentially getting oriented or going through orientation? So one of the biggest things we that we really need to happen when a student is being oriented to a clinical site is exposure to essentially your critical incident response plans or procedures in the athletic training world. That really for us, that's our emergency action plan. So in a lot of our clinic environments, what are your emergency action plans for different types of scenarios? How do you handle emergencies in your setting if they arise? That is something that will need to be communicated with the students. Uh, any plan that you may have in place for bloodborne pathogens, exposure, location of sharps, um, places, biohazard, all of those types of things, right? Any communicable disease, excuse me, policies and procedures as they are utilized within your environment. And then this is a big one: your documentation policies and procedures, right? If the student is assisting you in any way, shape, or form with documentation in your setting, ensuring that they are knowledgeable and know how to utilize any documentation, software, and/or forms that you may have within your clinical environment. Clearly, they should be practicing in a way that protects patient information, right? Upholding HIPAA, right? Um, and then obviously, all of our students as well, uh, when in a clinical experience, should be easily identified as students. And the way that we execute that from a program perspective, all of them have name tags that they wear when they are present in a clinical experience to differentiate them from a provider, right? So all of them are students and should be easily identified as such through the use of a name tag. All right, so let's really quickly talk about the goal forms, and I'm going to shift back to eValue, and we're going to go. I'm going to just show this to you again. Once again, all of these have been automated in eValue, and so these will all be sent out automatically. So I'm going to show you. I'm going to log in as another one of my students here. I'm going to show you exactly what these goal forms look like. So these have been the forms that we've used for forever. We have made some changes to them. So our student Joseph Schmidt here has a few evaluations that he needs to complete. These are his end of experience evaluations. We'll click into those in a minute, and I'll show you those as well. But let's talk about his goals and proficiencies for a second. Let me go back to the ones that he's done. There we go. Okay, so this is an example of our goal form here. Okay, so you can see the student goes through and fills out 23 questions, right? And so these are all really kind of open-ended responses for them to go in um, and not only articulate their goals, but how they plan to essentially achieve those goals and what their timeline is for achievement of those goals, right? So every student will fill out prior to starting an experience. They will go in and fill out their own goal form, and then they will submit that. And then right after they submit that, you will see you'll get a notification as a preceptor that the student has submitted the goals, and then you will be able to go back in um, and fill out your question, your goals for the student as well. So as you continue to develop experience as a preceptor, you will learn really what goals are important to you and what is necessary within your practice environment. Okay, so this is. I'm going to go back and let's go back to Joe. So this is actually um, Joe's evaluation for his end of experience evaluation. So this is um, his self-evaluation. So I'm going to click into this, and you can see this is actually one of his end of experience ones. Same thing. He's going to go through and fill up these questions, and everything is literally right here, right? So really easy and simple. Okay. Once the student gets to, um, or rather has completed those goals, the student actually has a portfolio. So at any point, and particularly at the mid portion of the experience, there will be another evaluation that you will be prompted to complete, and that the student will also complete at the end, or at the mid portion, and then at the end. And you'll have the opportunity to see all of the goals that the student has actually completed here on their dashboard. And you can actually even kind of kind of sit down and chat and be able to really kind of debrief with the student to see if they feel and if you feel that they are in fact accomplishing those goals that they set out for themselves. And so the portfolio is kind of a new platform, kind of a new tool for you to be able to kind of see everything in one place. Okay. Um, all right. So those are really the evaluations. And if there are questions, and I'm sure there will be, right? Please don't hesitate to reach out to myself or Mary. For a lot of our on-campus folks, I can, if you have a question, I can pop out of my office. I can come see you. I can answer any questions that you may have. Um, and then obviously for our off-campus preceptors, I am a phone call or an email away. And my cell number is actually at the end of the presentation. So competencies, okay? Our competencies, we previously we were having our preceptors fill these out. We are no longer requiring preceptors to grade competencies. That is something that has been reabsorbed by Mary and myself, right? So all grading of competencies is something that is completed by the faculty. At any point, a preceptor is welcome, by all means, to take a look at a competency and practice skills with a student, but you are no longer required to grade those competencies. So our competencies are graded on a scale of 0 to 5, right? And so obviously our 3 is our benchmark that we want them to meet for entry-level practice. It is completely and totally reasonable that a first-year student may not score above a 2, and that's okay, right? And that is reasonable for someone who is within their first year within a program, okay? But obviously, if they're rated at a 4 or 5, that is reflective of obviously someone who's an advanced practitioner and or clinical expert, right? And I've been an athletic trainer for 17 years, and I'm definitely still, right, not an expert uh, in some areas for sure, right? So these are their competencies that they are being, kind of taught throughout the program, and we will continue to update these obviously as the program continues to progress. Um, Proficiency assessments, as we talked about, we won't really get into that today. Those are for our second year students. We'll talk more about that next year, right? And we talked about supervision. We've been through this, more than once. But another really key important point in regards to supervision, right, is that as a preceptor, particularly in regards to safety, a preceptor should be able to intervene, particularly if they feel that a patient safety is being compromised or okay, that learner safety is being compromised, right? So a preceptor should always be able to step in the event that they feel that the patient or the learner is in potentially a compromised or dangerous situation. Okay, contact information. So Mary and myself, office number, cell number, and email. We have a third faculty member that we hired this past spring, Claire Webke. I do not have a cell number or email for her here or a picture, but that will change. Um, as we get that information, right? The bottom line is that we are here for you. If you have questions, please email, please text or call, right? We will help you in any way that we can, and we are just a phone call or a text away or an email away. Cappy Blockett. Cappy is our new administrative assistant. Joined us last year, but when you get an administrative email from Cappy and or a notification of an evaluation, um, it will likely have Cappy's name on it. Cappy is our email administrator for eValue, and so you will be seeing her name quite a bit, but Cappy is our administrative assistant for our program. Okay, so all of you, particularly those of you that are athletic trainers, uh, essentially within a calendar year, if you meet a minimum of 200 hours of kind of preceptorship, right, you qualify for 5 Category B CEUs per year. And I apologize for the old date here, but if you have that many hours as a preceptor from previous year and you want CEUs for this next reporting period, please let me or Mary know, and we can get you that certificate. Okay, that is it. We finished right on time, inside of an hour. That was super fast. Okay, and I know I kind of zipped through that. Um, thank you, thank all of you. So, really quickly, as we wrap up and call it an afternoon here, what questions can I help with or answer as we wrap up? It's a big no. Okay. Hey, I guess that means I did a good job, right? Or I did a horrible job. One of the two, right? You don't really know what I said, or I think I got it. So. Good deal. Okay. So things that you're going to get from me this afternoon, you're going to get a welcome email from me, talking a little bit about eValue and what we need from you as a preceptor, and then you will get an email from eValue prompting you to essentially reset your password so that you can log into your account. Okay. Please do not hesitate at any point to reach out with any questions that you may have. I appreciate all of you immensely. Okay. Thank you. Thank you. Thank you. Have a great day. All right. See ya. And then, Clark,
Thanks a lot, Wade. Take
do you
care.
have 2 seconds, Clark?
Yep.
Okay. Thanks, guys. Thanks, Reggie. Question for you. I know I'm going to go ahead and stop recording. Do stop. Perfect.